What happens when leadership stops making excuses and starts delivering results? What happens when health stops being a privilege and becomes a right? What happens when a government sees every citizen not as a number but as a life worth saving? In just 2 years, the health sector of Plateau State has undergone a quiet revolution. From neglected hospitals to revitalized health institutions, from manual records to digital systems, from hope deferred to healing delivered, dilapidated versus modern facilities, crowded waiting rooms versus digital patient queues. At the heart of it all is a governor whose leadership is defined by vision, purpose, and service. This is Healing the Plateau, Governor Mutfwang'S Health Revolution.
We came in, it was a situation we found that was rather despondent. We swung into action immediately, dealing with it from the primary health care, which is the foundation, and to the tertiary institution, which is the Plateau Specialist Hospital. And I'm glad when we celebrated the 2 years anniversary, some of you went with us on a tour of the Plateau State Specialist Hospital, where a lot of improvement has been done. Projects that were started during the Jiang administration, were able to complete them, commission them. And today, one of the high points of that initiative is the setting up of a modern lab, which is comparable to any health institution in the country. Today, I want to believe that our medical personnel in Plateau State Specialist Hospital will not just be doing guesswork, they will do evidence-based diagnosis to be able to deal with all the complaints of people. We've also been able to improve departments within the hospital. If you plot a graph in the health sector, I'm sure you're going to find that it's in an upward trajectory. And hopefully, we intend ultimately to cash in on advantage of our weather to really build capacity for medical tourism.
Governor Mutfwang'S first policy direction in health was clear: to reposition the state as a hub for medical excellence and grassroots access.
The Governor of Plateau State, His Excellency Barrister Manasseh Mutfwang, in the last 2 years has made a lot of commitments into the health sector in terms of all the activities that are going on. You know that the Ministry of Health oversees minimum about 6 agencies. These agencies include the Plateau State Specialist Hospital, the Plateau State Primary Health Care Board. We have the PLASCHEMA, which is the Plateau Contributory Health Insurance Scheme. We also have the Drug and Medical Commodity Management Agency. We have also the Hospitals Management Board. And of course, the Plateau AIDS Control Agency, which is directly reporting under the Office of His Excellency. All of these agencies are doing so much, and in the last 2 years, I can tell you His Excellency has made a lot of commitments. In terms of the Hospitals Management Board, His Excellency, since coming into office 2 years ago, has ensured that the 4 hospitals that were not performing at that time, they were not yet functional. Equipment, some were already equipped, but there were no staff. And of course, the activity was not yet commenced. And he ensured that more additional equipments were purchased, staff were deployed to those hospitals, and they commenced seeing patients. These hospitals were the General Hospital in Mabudi in Lantan South. We also had the Cottage Hospital in Kwal, in Kanke local government. Then, of course, the hospital in Riom. You know that we also have a trauma hospital in Riom. And so these 3, in addition to the reactivated Siken Hospital, which we commissioned alongside. Siken is in one of the areas in Bokos local government. And so based on that, we currently now have over 19 general hospitals, including the one we recently approved for upgrade, the primary health center in Wase, because The General Hospital in Wase was upgraded to a federal medical center. Currently, there are about 82 facilities that are being revitalized at the various stages of completion, and they are spread across all the 17 local governments of the state. Of course, it's an impact-funded project with commitments from the state government. In addition to that, His Excellency has also put in funds to renovate not less than 15 of such primary health centers since coming into office. We believe that in the next few months, all of these 82, in addition to the 15 that we're talking about, will be fully functional, and we are in the process of even recruiting more staff for these primary health centers. For us in the Ministry of Health, in addition to all the policy things that we oversee all these agencies, we've also been involved in so many other activities. Outbreaks that occur in the state, like the cholera that happened in Bokos, we had to intervene swiftly through the support of His Excellency to ensure that not many lives were lost. We've also had to intervene because of the crisis that has been happening in the state. So many communities that were affected had different internally displaced persons, and so His Excellency provided funds for us to take care of their health needs, and we've been going to some of those communities to ensure that they have the best. We are also refocusing based on the swap projects that are going on all over the country. His Excellency has been giving a lot of support in those areas. He has also been supporting the nutrition activities in the state. Not too long ago, the state government committed about 500 million for nutrition materials to be supplied as counterpart funding for UNICEF to give us those nutrition materials. Just about 2 weeks ago, those materials arrived to the state, and now we are in the process of distribution. The Cottage Hospital in Kwal, in Kanke local government, similar work has commenced there. Staff are now working fully, equipments are there, and everything is working effectively. Most importantly, Siken was abandoned for over 20 years. The hospital was not functional. But since His Excellency came on board, in the last 2 years, he has committed resources to renovate the touch the lives of the Plateau people. We are blessed to have the person of Manasseh Mutfwang at this time on the Plateau.
At the heart of Jos lies the Plateau State Special, now transformed from a neglected institution into a beacon of excellence.
Plateau State Specialist Hospital has been in existence for the past 93 years. On assumption of office, I discovered that the lab, which was in existence then, had been gutted by fire, and that the whole laboratory services were scattered around the hospital and were poorly organized. So that led us to write His Excellency, the Executive Governor of Plateau State, Barrister Manasseh Mutfwang, who, because of his love for health and also because of his commitment to the health and welfare of the citizenry, agreed to continue with the abandoned projects of the laboratory building, the admin block, and the pediatric complex. But at the point he assumed leadership were abandoned. Currently, the lab building has been completed, and the building has not just been completed, but equipped, with state-of-the-art laboratory equipment. This equipment cuts across chemical pathology, equipment in hematology. We also have equipment, related to clinical microbiology. We also have equipment, around anatomic pathology. And all these equipments are in pairs, and some of these equipments can also check hormones and things around fertility, things around cancer, many things that hitherto most people have been sent outside of the states to go and do, those investigations. And apart from getting the equipment, we've been able to train the laboratory staff, hopefully. And related to this is a need to ensure that when we have power outages, services are not left to suffer. So because of that, His Excellency also supported the hospital to establish a solar inverter system that will give us backup power. I think the backup power right now is about 157 kilowatts. We're targeting to get to at least 250 kilowatts. But so far, because of this solar system, we no longer use diesel generators to run the core services.
In just 2 years, the administration has recruited 22 specialist consultants from core medical fields, from cardiology to psychiatry.
Before I came on board, the hospital runs residency training in family medicine. And we realized that for us to expand, we need to get other core specialists in other areas of medicine. So His Excellency to the employment of over 22 new specialists, consultants into the hospital. Right now, we have surgeons on ground, general and urological surgeons who have been employed. We have internists, medical doctors. We also have specialists in cardiology, as the heart and things related to the heart. And we have eye specialists that have been employed. We also have pediatricians, those who suit children. We added upon the gynecologists who are on ground. And so as it is now, we have specialists in orthopedics, that's bone and bone related, and also ENT. So you can see the quality and the spread specialist services has greatly improved as a result of the intervention of His Excellency Barrister Manasseh Mutfwang. That the hospital has moved tremendously from where it was, before to where it is now. While we have not gotten to where we intend to be, I know that His Excellency's heart is here.
Residency programs have expanded. New blocks have been revitalized. Solar energy now powers emergency units, while security cameras and floodlights enhance staff safety. Across the local government areas, general hospitals, once reduced to referral outposts, now function as full-fledged health centers.
Before his coming in, this department was not even here in this hospital. So with his coming in, the department was built, X-ray machine was installed, ultrasound machine was installed, and in the X-ray machine, there's the digital X-ray machine and the analog. So the analog serve as the backup of the digital in case there's a breakdown. Since the operation of this department, before then, patients used to go for ultrasound and X-ray investigations in other hospitals. But with the opening of this department, patients now have access to services 24 hours because I'm a 24-hour, I'm a call staff. So at any time they call me upon and I come to attend to patients. Drugs are available and the cost has really gone down. Patients are very, very happy. I think it's a very laudable process. And
I want to thank our governor, Barrister Manasseh Mutfwang. We have seen his work pertaining the health sector. So many lives have been saved because the facilities are up, so to say. So we are thankful because we are beneficiaries of this.
We have had a number of interventions here in the hospital, one of which is the eye hospital where we are currently. The hospital was commissioned November 2023 and was fully equipped, as a matter of fact. We have thankfully been able to utilize the facilities available as much as possible to provide various forms of ophthalmic interventions to members of the community function. And we have offered a number of surgeries, actually in their hundreds, since the commissioning of this facility. We're also recently gifted a 20 kVA solar inverter system with solar panels. It's primarily to provide electricity to the maternity unit of the hospital, with an extension to the OPD, as well as the theater and accident emergency of the facility. We are very much appreciative of the government of Caleb Mutfwang, by the end of last year, the oxygen plant was built, was completed, and in March this year, it was commissioned by the Honorable Commissioner for Health, who was representing the Executive Governor of Plateau State. Since the commissioning of the plant and its operation, we have not been lacking in oxygen, and we have also been able to supply oxygen according to the needs of private and government facilities.
Particularly in General Hospital Shendam here, I want to appreciate him starting from the issue of staff welfare. When the governor came in, we were being owed about 5 months' salaries. And he came in, he cleared all the backlog of those salary arrears. Apart from that, he has approved promotion for most of our staff who are due for promotion, and they have enjoyed that promotion.
We have a digital X-ray machine that was donated, and then it has made our work easier and faster. Unlike the analog X-ray machine that you have to go and process. When you take an X-ray, you have to go and process in the dark room, which takes longer time. But this one, within the shortest period of time, at most, within 3 to 5 minutes.
The government partner with the national energy system, and there is a solar power plant that has been installed in Shendam. So with this, we are able to function 24/7 with constant power supply. Secondly, the oxygen plant too has been commissioned here, whereby we are producing oxygen in the oxygen plant, which is supposed to supply the whole of Southern Senatorial Zone. So this has helped us a lot in patient management. Patients that need oxygen, they have quick access to it. And facilities, both government facilities and private, they are coming here to get their oxygen. So we thank the governor for this.
To ensure sustainability, Governor Caleb Manasseh Mutfwang has inaugurated traditional rulers as health ambassadors of primary healthcare initiatives in the state to drive community ownership.
We also recall that about 2 weeks ago, His Excellency had an engagement with our traditional rulers, and the aim was to make sure that they become advocates, they become ambassadors of the primary healthcare system at their community, such that they can monitor what is going on at the various primary health centers. This to us is a reflection of ensuring that at the local community level, they take ownership of all the facilities that are within their own system.
Determined to end the era of fake and substandard drugs, Governor Mutfwang commissioned the Plateau State Drugs and Medical Commodities Management Agency.
So the Drugs and Medical Commodities Management Agency, as enshrined in the law establishing the agency, signed in October 2022, Section 4, subsection 1 to 7, provides functions as the agency being the only source of medications that are safe, effective, and highly qualitative to government-owned hospitals. In this case, we are referring to the over 1,000 primary health facilities. We're also referring to the 19 secondary health facilities, that's the general hospitals, and then Plateau State Specialist Hospital. And so, being the only source, we must continue to reiterate the importance of safety, quality, and efficacy of these medications. Secondly, we are saddled with the responsibility of tracking adverse drug reactions, and then based on pharmacovigilance activities. Thirdly, local manufacturing. The fourth one is to warehouse. The fifth is to distribute these medications and carry out all supply chain activities. And then we must as well, another function, ensure accountability of everything we do. We also look at the humidity of the warehouse, and so far so good. We have ensured that we live up to expectation. Where the temperature is high, we do our best to manage it. And that's why we have 8 5-ton ACs installed within the warehouse. What about the humidity? We have also tried to manage the humidity by ensuring that We tint all the glasses within the warehouse so that we'll be able to manage photosensitive medications, photosensitive items, photosensitive reagents for laboratory activity, and even other forms of commodities. This is the only way we can maintain quality of medications. On September 10, 2024, this agency, Plateau State Drugs and Medical Commodities Management Agency, was officially commissioned by His Excellency Barrister Manasseh Mutfwang. And on the same day, another very giant stride was commissioned by His Excellency, and that's the Plateau State Emergency Ambulance Services and what we call PLASEMSAS. It was commissioned the same day and has kicked off function. And I'm telling you that all over the country, Plateau State is one of the few states that has come up where the state government even purchased ambulances before the commissioning. 6 ambulances were commissioned, very functional, fully equipped to manage emergencies and deliver to the people.
From 93,605 enrollees in May 2023 to over 208,550 by March 2024, the Plateau State Contributory Healthcare Management Agency is rewriting the story of healthcare access.
The Mutfwang'S Equity Healthcare Plan has impacted positively on these our enrollees by reducing the financial barrier that this category of people who are categorized as the poor and vulnerable face when accessing healthcare services. And the amount of money that these beneficiaries will spend when they access healthcare without, insurance is about 16,000 on average, 16,500 naira. But because they have been enrolled on this program, they can only pay a stipend, just a small amount. This latest study that we have done, they spend on average 1,650 naira only compared to 16,500 naira that most of these enrollees would have spent while accessing healthcare. And they have access to quite a number of healthcare facilities of their choice, about 450 facilities that are spread across the 325 wards of the entire states. The new ICT system that we have in place has drastically changed the implementation of our program. In time past, revenue collection was not automated. People come to pay cash, but now we have automated revenue collection. And that has drastically reduced incidences of premium loss, which is a drain on our finances in the agency. Also, enrollee ID cards are produced very long before they are able to get their enrollee ID card. And without the enrollee ID cards, we are not able to access healthcare. And also, we have a real-time dashboard that informs, decision-making. We can access it. Even the executive governor himself can access that enrollee dashboard to see exactly what is ongoing. Other stakeholders can also access that dashboard.
The government of Barrister Manasseh Mutfwang has made remarkable impact on the health sector, being that the health sector was one that we met it at a state that wasn't very encouraging. However, I must say that there is so much that is demanding on the health sector. The various sub-departments under the health sector are all calling for attention all at the same time. On the coming of Barrister Manasseh Mutfwang, he gave his word to revive that sector. And I like to pay attention more on what he has been able to achieve at the primary health care level. That is one department that affects directly the people at the grassroots. And what Barrister Manasseh Mutfwang's government has been able to do is to take primary health care from level 1 to level 2. His promise to the people of Plateau State is to be able to take every federal ward in Plateau State to have the basic primary health care in it.
Under the Improving Maternal and Child Health Project Impact, the state has recorded fewer maternal and child deaths, higher immunization rates, and safer deliveries.
Not too long ago, His Excellency also started the process of what we call the Mommy Kit distribution. This is a kit that is given to pregnant women that come to deliver in hospital for free. This kit contains all that a woman needs for her to deliver her baby. So these are things that are touching
to deliver my baby, and all I can say is that I'm very grateful. I gave birth successfully and safe and sound, thanks to the nurses and doctors for being there. With their protection and guidance, I gave birth successfully. And I want to thank His Excellency for what he has done and what he's been doing to the hospital. Thanks for the pediatric ward that he provided unto us. I want to say thank you.
207 motorbikes now enable outreach workers to reach the remotest corners. The malaria burden among children under 5 has dropped dramatically from 35.8% to just 15%.
Immunization activities has also been enhanced. The malaria program that is being anchored by the State Ministry of Health in collaboration with Malaria Consortium is given a lot of attention. His Excellency has given a lot of support. We've had a lot of training. Currently, we are doing the malaria seasonal treatment for children between the ages of 3 months and 59 months. In various communities across all local governments in the state.
In anticipation of future demands, plans are underway to establish a Department of Medicine at the Plateau State University, Bocas, preparing a new generation of health professionals.
Like they say, health is wealth. And when we came on board, we reasoned that the health sector is very critical to every other sector. Without health, there will be no work, there will be no productivity, there will be no contribution called human labor to development. And therefore, we decided to look holistically at that sector. The health sector in the state, like any other state in Nigeria, is divided into 3 basic sections or segments: the primary healthcare segment, the secondary healthcare segment, as well as the tertiary segment. Now, it's very difficult to abandon any of the segments and concentrate on others. So we decided to look at these 3 segments holistically. For the primary healthcare segment, we have 1,250 primary healthcare centers in Plateau State or thereabout. And we decided to begin to systematically upgrade them in line with the national policy on primary health care. And so we keyed into one of the World Bank projects called Impact. Apart from that, we also financed some from budget. And we also encouraged our legislators to also see how to get involved with their constituency projects so that we can upgrade that segment, which is very tangential. At the tertiary level, we've been able to invest heavily in upgrading the Plateau Specialist Hospital from a specialist hospital with 2 departments. Today, we've been able to have 6 departments, and we've been able to recruit more doctors, more medical personnel. We've invested in buying equipment, state-of-the-art equipment. The lab, we have been able to organize the lab, invest heavily in the lab to ensure that it is second to none, even within the country. And so there's a lot of improvement in that sector. The Plateau State Insurance Scheme plus chairman has done extremely well. From an enrollment level of less than 100,000 people, today we are almost hitting 300,000. And that is a great improvement. Part of our attention to the health sector drove us to agree with the National Universities Commission to start a medical faculty at the Plateau State University in Bocos. And I'm glad that we are getting ready for takeoff, and therefore we have also seen the need to therefore establish a teaching hospital, which is a prerequisite for graduating medical students. And it's our ambition that when we are done with all the reforms we are doing, that everybody in Plateau State will be able to have access to good care at very, very minimal.
It is rising with a governor who leads by doing. This is how you heal a people. This is how you build a legacy. This is Healing the Plateau, Governor Mutfwang'S Health Revolution.